I had like a yearly checkup through work. My blood sugar came back in the pre-diabetic range.
Type 1 diabetes can be diagnosed before symptoms appear. That's why it can be called invisible or silent.
I have not had, and I still have no symptoms.
Trying to tell the difference between type 1 and type 2 diabetes can be really difficult. Type 1 diabetes, you're destroying the cells that make insulin. And in type 2 diabetes, people make a lot of insulin. Their bodies just don't use it very well.
Having diabetes is not stopping me from living the life that I want to live. I live in Boulder, Colorado. I love everything outdoors. I love biking, hiking, trail running, especially rock climbing. So if you're doing like big mountains, there's like a lot of objective risk with avalanche and other things. With ice itself, you have to be mindful of ice conditions to make sure the ice isn't too soft or too hard. The dry tooling itself is pretty similar to rock climbing. That's not very dangerous as long as you're taking proper precautions. You have a rope to protect yourself if you fall, things like that. You ready to go hiking? I take, being a dad very seriously, as it's a big commitment to bring life into this world, and I have a lot of responsibility to them. And I also see that there's all these things I really enjoy, and part of that is because my parents brought me to Colorado as a kid. I have these experiences hiking and camping with them, and I really want to do that and more for my kids. So something I made sure to do with my older kid is before he was 1, I wanted to take him on all 5 peaks that compose the Boulder Skyline Traverse. I've gotten comments like, "Super Dad." I've gotten some looks. I think some people are maybe a little confused by it. It's not something you see every day. I work out a lot, and I do that for a few reasons. One, I really just enjoy all these activities, and I have a ton of activities I like to do to stay in shape. And two, I've found that certain types of workouts actually really help me manage my blood sugar. It was pretty upsetting the first time I got told that I had to see an endocrinologist. I'm trying to stay in shape. There's no family history here. What is going on? This can't be real. So there was a lot of denial. Then there was just facing a lot of, well, what kind of changes does this make on my life? And it's actually pretty scary. My name is Joey, and I have type 1 diabetes. I think it was back in 2018. I had like a yearly checkup through work, and my blood sugar came back a little bit high in the pre-diabetic range. And that was a bit surprising as I was pretty active, and I just figured, they keep providing lots of free cookies at work. My doctor in Florida didn't seem very concerned at the time, and so I didn't really think of anything of it that year. Then the following year, similar thing happened. It was still in the high range, even though I'd kind of cleaned my diet up a bit. So my wife was kind of concerned.
But if you have a family history, your risk becomes about 1 in 20. And although that's the biggest risk factor for type 1 diabetes, it's also important to know that close to 90% of the people we see come in clinic do not have a family history of type 1 diabetes. So there are a lot of people that don't have a family history, showing us that genetics is not the primary factor that causes type 1 diabetes.
My wife took it really seriously and pushed for me to get care when this was a repeated year after year thing on my physical that I had high blood sugar. And she's actually told me that she was pretty sure I had some type of diabetes prior to marrying me, and really appreciate that she still married me despite knowing that.
So the classic symptoms of type 1 diabetes are increased thirst and increased urination. And then people, if they're not getting energy for their bodies have a backup way of getting energy, which is breaking down fat and making ketones. And breaking down fat will cause people to lose weight. So classically, it's losing weight, drinking more, urinating more, and especially at night happens to be the first time people realize that something's different as they're getting up at night to use the restroom more often.
I have not had, and I still have no symptoms. Like, even if my blood sugar goes high or low, I don't get any symptoms. I don't feel like really anything.
Type 1 diabetes can be diagnosed before symptoms appear, and so that's why it can be called invisible or silent or pre-symptomatic. And it can be diagnosed by measuring islet autoantibodies in a person's blood. Islet autoantibodies are the markers that are made by certain immune cells when the body is starting to attack the beta cells that make insulin. But until enough cells are attacked that blood sugars are affected, people are not going to have any symptoms. Over half of the people in Colorado that see us are actually in the hospital in the intensive care unit first because they have diabetic ketoacidosis. Diabetic ketoacidosis, or DKA, is what happens when diabetes goes unrecognized for too long. So the body is not making enough insulin to allow the body to use glucose for energy, and it starts breaking down fat and making ketones for energy. And along with making ketones, your body makes a lot of acid, and that acid can be extremely dangerous. It can lead to organ damage and in some cases even death. And so it's a pretty dramatic entry into having a medical condition. One of the things that we can do now is identify type 1 diabetes early. So we're starting to have more people through screening programs where they have a blood test and we know that they'll develop type 1 diabetes eventually. Trying to tell the difference between type 1 and type 2 diabetes can be really difficult, especially in adults. But there are a few key factors that help differentiate whether it's type 1 or type 2 diabetes. Type 1 diabetes is an autoimmune disease and you're destroying the cells that make insulin, so people don't make much of any insulin. And in type 2 diabetes, it's a disease of insulin resistance, so people make a lot of insulin, their bodies just don't use it very well. And so from testing labs, you can have some sense once people are diagnosed what kind of diabetes they have. And so if you're in early stage type 1, that means that your A1C is less than 5.7%, your glucose levels are pretty normal. The stage 2 is what people have thought of in the past as kind of prediabetes. So an A1C between 5.7 and 6.4%, and blood sugars that aren't quite normal but aren't causing symptoms. And stage 3 is what we usually think of as type 1 diabetes, which is high blood sugars causing symptoms and people needing insulin.
So I'm still in stage 2 of type 1 diabetes, so I don't need insulin, but I do wear a CGM.
People with type 1 diabetes have to monitor their glucose levels carefully. So some people will use a blood glucose meter or a glucometer to check their glucose levels, and we recommend doing it before meals and at bedtime. Usually it ends up being 6 to 10 times a day for people that are well controlled.
I know pretty much it's inevitable that if you're stage 2, you'll eventually become stage 3. I've heard from some sources that that's not 100% the case, but you can pretty much consider that a 100% guarantee unless some new research breakthrough comes through at some point. I'll be getting an insulin pump.
Down on the big construction site, the tough trucks work with all their might to build a building, to make a road, to get the job done, load by load.
There's no reason to think that there should be any problems from having to take insulin. But I think it's just a thought in adults of not wanting to go from being a healthy person to all of a sudden having a chronic medical condition. So I think as a community and as a provider of someone who takes care of patients with type 1 diabetes, we always want to be encouraging and tell people that they can live a totally normal life without limitations, which is true, but that's also a lot of hard work.
Then cuddles up to say goodnight.
People have to take their insulin. And so if it's because they don't have access or because they're burnt out and they don't want to, or for some other reason, they can end up very, very sick. Acutely, they can end up in the hospital or they can end up being found at home dead because they have had so much acid in their blood that their brain has been affected and they have died.
Where's John?
He's asleep.
My wife Jen has just been kind of my pillar through all of this that I've been able to lean on, and she's really been pushing me to get the care I need, to take it seriously, to kind of come to terms with having to start attaching these medical devices to myself. And it's just been really great knowing that she's going to be there for me through all of it, no matter what happens. And I just really appreciate having her in my life. It definitely gives a lot of motivation that I want to be around as long as I can. Especially for them, for any potential grandkids. One of the big things I want to do with my kids as they get older is I want to stay really active with them, take them hiking, climbing, and I want to be able to, do that for a long time.
I think that The toll that type 1 diabetes takes on the family is one of the most unrecognized complications of type 1 diabetes. I think that if we asked more siblings and asked more spouses and asked more children of people with type 1 diabetes, we would find that having a close relative or even friend with type 1 diabetes really does shape how they view the world. I'm very hopeful for the future in type 1 diabetes. Now we're in an era where we've seen many medications that we know can keep the cells that make insulin around for longer, just not permanently. I feel like the door has really been opened, and there's a lot more interest in trying to come up with therapies that can intervene in the type 1 diabetes disease process. And I also think with how fast technology is progressing and potentially even stem cell therapy and other options like that, if we can give patients treatments that buy them some extra time, by the time they need insulin, there may be very different options available to them than there are at the current moment.
I think the really big thing that I've learned in my journey is that having diabetes is not stopping me from living the life that I want to live. And it, might make me approach things differently. Obviously, I have the CGM. If I'm doing a long outing, I have to be checking in on that, making sure I'm maintaining my sugar, but it doesn't prevent me from going and doing an alpine climb. And so I think the really big message is that you can not just live with type 1 diabetes, but you can thrive, you can adventure, you can explore, and it just might take a little bit more planning.